A new study is adding to the tense nationwide discussion around the spread of COVID in schools. One of the doctors on the study concluded that rates of illness are lower for kids who are in school than out of school, suggesting the whole community is better off with schools open. That doctor joins us now. She is Dr. Daria Long, clinical assistant professor at the University of Tennessee. Dr. Long, good to see you.
Hi, Fred. How are you?
I'm good. So you studied, or this study looked at two independent schools, one in the Southeast, one in the Mid-Atlantic area, and your finding was the rate of infection or spread was low, and thereby your feeling is it's universally okay for kids to be in school. They would be safer in school than to be at home, interacting with the community. Explain why you concluded that.
Yeah, Frederica, and there's some big ifs and requirements there. What we found out is that it can be safer if you follow very conservative policies in terms of protocols for distancing and masking and who gets quarantined, and also if you are testing. This came up when we were in June and July and talking to these headmasters and saying, how can we safely open? And we realized it was going to be a multi-pronged approach that included all of those things, because otherwise, A, we were flying blindly, and B, we knew we'd get to January now, still have COVID going on, and not be any wiser than we were in August. So we said, let's start with these protocols, let's start testing and see what happens. And
so
we did fine.
At these two schools, you found that, about 9% of the population of kids became infected? Help us understand that.
What we found that 9% is that 91% of COVID that walks in your door, somebody who comes in, because every school knows that, yes, some people will walk in with them. Because of the protocols and because of testing, 91% of them never transmitted to anybody. And of those 9% that actually did transmit to someone else, we could almost invariably trace them back to a violation of the protocol. So those testing really enforce that when the protocols are followed, they work. When they're not followed is when you can have breakdown. So
these were independent schools, and most independent private schools have more resources. They're changing their ventilation system. Perhaps they have the space, to respect social distancing. For public schools, they would still be saying, we want you to wear masks. We want you to wash your hands. We want there to be social distancing. However, is it fair to compare these two independent schools with, say, urban schools, more densely populated areas, places where kids are commuting greater distances, whether they're on public transportation or even buses?
Well, you make a good point there. And Frederica, one of our goals was to say, let's do all of these different protocols, and then let's see what is necessary, what isn't, so that we can then translate this on something on a much bigger scale to schools that may not have the greatest resources at hand. And that's why we've kind of transition to now say, okay, what does this mean as the Biden administration is looking at helping schools reopen? What does it mean they need? It means that they need a really centralized protocol. Both of these schools, since we were kind of reinventing the wheel, would joke and say, we feel like we're running our own public health department. We can't make all the different schools do that. So a very centralized guidelines and protocols from the government. And two, Frederica, we have to make testing available and affordable. We spent hours and days finding tests. People talk about these $5 tests. They're not available yet, not for the K through 12 population. It's incumbent upon the government to help make that feasible for schools.
All right, Dr. Daria Long, thank you so much. We're going to talk more about this later on in the afternoon. Parents all around the country are very frustrated, with the fact that some schools are closed. They're concerned about their kids' safety as well.